Once again, from the studios of UNO Television on the campus of the University of Nebraska at Omaha, consider this, a program of issues and information behind today's news.
I am declaring the current outbreak of Ebola virus disease a public health emergency of international concern. The committee's decision was unanimous. Its advice to me acknowledges the serious and unusual nature of the outbreak and the potential for further international spread.
Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, Ebola. Joining us to talk more about it is Dr. Mark Rupp. Dr. Rupp is professor and chief in the Division of Infectious Diseases at UNMC. Thank you so much for being here. Welcome.
Kathy, glad to be with you. Thank you.
Let's start with a day in the life of an infectious diseases physician.
Sure. So many of your viewers probably don't know what an ID doc is. And so an infectious disease physician is first a doctor that's gone through med school, and then we all train in internal medicine, and then do another 2 to 3 years of fellowship training where we specialize in infectious diseases. So we learn about how to recognize and diagnose infections, how to treat them, and hopefully how to prevent some of them. And then we're called on by our colleagues when they encounter a particularly stubborn disease or perhaps a host that's immunosuppressed and they need a little bit of special expertise, and that's when we get involved.
Wow, how are you introduced to all of this? Why the interest?
Well, I think that there is a lot of interest in infectious diseases right now for a lot of different reasons. So a lot of your viewers have read these reports of increasing antimicrobial resistance or some of these outbreaks like we're going to discuss here in a few minutes. And there's luckily some of us like myself who are very interested in these things.
Well, but the question is why? Were you always interested in science? Were you one of those people who just knew early on that this was going to be a direction that you were going to take?
Well, I've probably always been interested in microbiology and science, and so it was sort of a natural gravitation towards infectious diseases. But it's like many of us, our careers take sort of strange tracks. And frankly, when I went into medical school, I thought I wanted to be a surgeon. And then here I am, probably the most unlike physician being a surgeon as you can get.
Wow. Here today to talk, of course, about Ebola. Can you start by telling us just what it is?
Well, sure. So Ebola is caused by a virus, and it's called a filovirus. So it's a long filamentous virus. It really looks very unusual, and actually on the monitor you can see that now. And so this is a kind of a mysterious disease. It wasn't really described until about the middle of the 1970s with outbreaks in the middle of Africa. And the reason that people are so particularly concerned about it is because of the high mortality rate associated with it. In these outbreaks, the mortality has ranged from kind of a low of maybe 30 to 40% to as high as almost 80 or 90% in some instances. So if you get infected with the virus, it has a very, very high mortality rate. Luckily for us, it doesn't spread that easily, and so it's not a particularly contagious virus. But it's been fairly mysterious, kind of comes and goes with poor explanation. And as we've gained more and more experience and knowledge, it appears that it's probably got a reservoir in some of the fruit bats in Central Africa, sometimes infects non-human primates, and then humans come into contact with it either through what they call bushmeat. So folks go out and hunt monkeys or other kinds of animals and get exposed to an infected animal that way. There's also maybe a little bit of evidence that in the bats within these caves, people who enter those caves may be exposed. So it's kind of mysterious. It's very worrisome, obviously, with its high mortality rate, and has obviously sparked a lot of concern.
Right, and concern especially now in West Africa. We want to go ahead and put up a graphic for our viewers so that they kind of have an idea of what's going on here. Doctor, walk us through what we're seeing.
Sure. So these are 3 of the 4 countries where we're seeing Ebola cases right now. And as you see, it's on the very western edge of Africa. Up until this time, all these outbreaks have occurred in central part of Africa and not on the west coast. So this is a brand new disease, unfortunately in some ways, for these countries. And so they're not used to seeing it, they're not used to learning how to deal with it, and the population in some of those areas are very ignorant of this disease. So that's kind of stymied some of our control efforts.
How did it then move from central to west? How does something like that get started, and why is this one so difficult for folks to control?
Yeah, so this has by far been the biggest outbreak of Ebola that we've ever described. There have been over 2,000 cases now with about a 55–60% mortality rate. So again, a very, very serious disease, a very serious outbreak. Why we're seeing it for the first time in West Africa, I don't think anybody really knows. Now, in looking at the beginnings of the outbreak very carefully, they've been able to trace the first case of this, they think, to a 2-year-old child in Guinea. And it occurred in that area of Guinea that backs right up against Sierra Leone and Liberia. And so within this remote area, it was able to spread to all 3 of these countries. And apparently, shortly after the 2-year-old child died, the grandmother and the mother died. People who came back for these funerals probably got infected, and this is one of the things that we can talk about. Some of the burial practices there probably promote the spread of this infection. So within this family, they then went to the other villages within these 3 countries, and that's really what started the outbreak. And this occurred, this first case, probably in December of 2013. The outbreak first came to Western attention, to the best of my knowledge, in March, and now over the last 4, 5, 6 months, we've seen it spread to the point now where we have thousands of cases and, again, a lot of deaths.
I do want to address the burial issue because I was reading about that and found that very interesting. What is actually transpiring there? Why is that?
Yeah, so this is very important that folks understand that this virus is not particularly contagious. So again, it's been going for months. There's been a few thousand cases. If you equate that to the outbreaks that we have, for instance, every year in the United States of influenza, you can see that, we have millions of cases over just a month or two, and that's a much more contagious sort of illness. So with Ebola, it's spread by close contact. And what promotes that is, again, some of these burial practices in these villages in Africa. They have ritualized bathing, and they have very close contact with the dead person. It's sort of a way of honoring that person as they say their goodbyes. And so with this very close contact, with this ritualized bathing of the body, with the burial proceedings that they do, there's a lot of contact with infectious secretions, because that's where it's really spread, in blood and body fluids. And when these people have died of Ebola, many times they have vomiting, they have diarrhea, they may be bleeding from other sources. So there is a lot of virus on them, and if you're not taking the appropriate precautions, it's easy to see where those infections can get started.
Right, and you mentioned appropriate precautions. I mean, if it's new to an area, right, like West Africa, talk to us. I mean, to say that is one thing, but to actually do it is another. This is foreign to them. So to know how to respond and even to accept assistance, right, is a whole different deal for them.
It is. So this is a new disease that they've never seen before, and there's a lot of ignorance about that within these remote communities. So for instance, one of the things that has really prevented, or at least made control of the outbreak more difficult, is because there is that ignorance. Many of these villagers apparently have equated the arrival of Ebola with the arrival of some of these non-governmental organizations that are coming to those areas to prevent the spread. And they've actually cordoned off areas. They've prevented healthcare providers from coming into some of those communities because they think they're bringing the Ebola with them. So you can see how difficult it is to stem this outbreak when you're dealing with that degree of ignorance. And unfortunately, these are some of the poorest countries in the world. They really have a very rudimentary health system, if any health system at all. Some of these places don't have running water, they have very minimal electricity, so it's really, really tough to work in those conditions.
Well, and you add to that the whole language barrier too. I mean, this is just, we're running uphill against the wind, especially for the people who are coming in from the outside to help. Tell us what a worker, what would somebody need to know going into that kind of environment? This isn't just your typical setup. This takes a lot of extra measures, right, for people to be safe.
Sure, so it takes a special kind of person who's willing to put themselves at risk and go into these communities, and they're obviously very altruistic, and I salute them for their efforts. Now, if they're going into that kind of condition where they're not working in a modern day hospital, again, lack of running water, difficulty of even doing simple hygienic measures, they probably don't have autoclaves and the ability to sterilize things. So when you're working in those conditions, that's when they put on these protective isolation suits that are important for protecting the healthcare providers in those sorts of situations. So many of your viewers are probably looking at that and saying, oh my God, this must be a horrifically contagious disease, and there's no way we want to bring that into this country or even care for any of those people. But the conditions that they're working at in Central Africa in these remote villages would be very, very different than what we would have here. Clearly we have modern hospitals with isolation procedures. We're able to sterilize things, obviously. We have all the disinfectants and the gloves, and we don't reuse needles and things like that, which sometimes they do in Africa. They actually reuse some of these gloves. They try to re-sterilize the needles. And so those sorts of things clearly promote the spread of this infection, where we would not have those conditions here.
Wow, people certainly have been exposed to some of the photographs, and we picked some of those for this program. It really does help tell the story and bring this to kind of the reality of it all. So we're going to start, and if you could, Dr. Rupp, just let us know what we're seeing here in terms of these pictures.
Sure. So this, is one of the supply trucks that's arriving in West Africa to bring some of these needed supplies. And as I mentioned, when you're dealing with some of these remote communities, they have just a complete lack of even the basic essentials. They don't have gloves. They don't have reusable, they don't have sterilized single-use products like needles and syringes and things like that. So clearly, you want to bring those things with you as you care for the patients in this sort of community. This is looks like one of the tent isolation units, because again, they don't have modern day facilities in many of these places. They lack climate control, for instance. So again, these healthcare providers are going into very, very primitive conditions, and you can see here, one of the tent hospitals that's been sent up. You can see the emblem there of the Doctors Without Borders, which is one of the groups that really go into these areas around the world, wherever there's outbreaks, and try to provide health care to these populations. This must be one of the testing facilities, or maybe one of the check-in facilities. You can see the healthcare workers are garbed in gowns and gloves. They're wearing masks. They should have eye protection on as well, which I don't really clearly see in some of these workers. But this is a place where they're going to be probably screening patients and trying to determine who's sick, who isn't, and then get them into care as necessary. But you can also see that this is a tent. It's open to the outdoors. Looks like it's a dirt floor. These are some of the conditions that are being worked in, and so this is why when you see the healthcare providers wearing sort of the moon suits, that's why it's so necessary in these types of conditions. This is, unfortunately one of the victims of Ebola. Again, you can see the healthcare provider fully garbed for protective measures in this instance. They have gloves that are taped to their sleeves of their isolation gowns. They're wearing a face protector and eye protection, a mask to protect their ventilatory system. And this is what is necessary, again, for caring for patients in these types of facilities. Now, if a patient were to come to a United States hospital, they would be caring for them in similar conditions, but they would also have a private room. They might have special ventilation to prevent the air from mixing with the rest of the hospital. And clearly the gowns and gloves and single-use equipment items are commonplace here. This must be one of the field laboratories. Again, special precautions would have to be taken when working with blood or body fluids for a lot of reasons, but obviously for Ebola as well. In some of these countries, the incidence of HIV and other bloodborne pathogens is pretty high, so they need to take special precautions even if they're dealing with people who they don't think have Ebola. And this unfortunately looks like one of the burial details. And again, when somebody has died of end-stage Ebola, oftentimes they're very, very sick. They've had bleeding from various sites, a lot of nausea, vomiting, diarrhea. And so the bodies are pretty much covered in material that would contain the virus. And so this is one of the more dangerous aspects of the care of these outbreaks and trying to stem the outbreak. And so you can see these workers are fully garbed to try to make sure that they don't come into contact with those blood or body fluids. And they're typically burying these patients, or in some cases cremating them. Again, in some of these areas, they've prevented some of these burial practices from occurring because they're afraid that the virus will stay present there and then contaminate the water, etc. So, you know, it's really got a lot of wrinkles to it and a lot of considerations as they go about trying to work on these outbreaks. And then this is one of the educational efforts. Clearly they've got somebody there talking to the villagers about the virus and what they can do to prevent it. They need to understand how the virus is spread from person to person. And education is really one of the best weapons that we have to put a dent into the outbreak. When people are ignorant, they don't know how the virus is spread, they continue to do some of these practices, it's almost a guarantee that it's going to continue to spread.
Wow. So let's recap then, especially after having seen, you know, the victims here. Symptoms, how do people know? You know, you were talking about all the garb that folks have to wear. How would they even begin to know that there is a possibility that they would have been infected with Ebola?
Sure. So again, some of the things to emphasize is it's not spread via an airborne route, so it's not something that you can breathe in generally. It's not something that you're going to get from food or water. You're going to get this from direct contact with an infected patient. Generally close contact. It's not, you know, me and you sitting a few feet apart. It's actual close physical contact. The incubation period for the virus is typically somewhere around a week to 10 days. It can range anywhere from as short of maybe 2 or 3 days to as long as about 3 weeks. And it usually comes on very abruptly with the onset of pretty high fevers, so typically 101, 102 or higher, along with other symptoms, so headaches, muscle aches, joint aches, nausea, vomiting, diarrhea. As it progresses, you can start getting the bleeding phenomenon. So you actually may have bleeding from the gastrointestinal tract, bleeding from the tear ducts, things like that. And so, you know, it's a pretty vivid kind of presentation, particularly as it, you know, develops into a full-blown case. You know, that's the typical course of these things. Folks, again, in this outbreak have had about a 50 to 60% mortality rate. So we've got, you know, 40% or so of folks who are surviving. They typically, you know, heal over a period of several weeks, and at that point they would be immune from the disease, presumably. They've developed antibodies. They've been able to fight off the infection on their own. There is no treatment, unfortunately, right now, or at least nothing that's been proven.
Well, so with no treatments, and you're talking 50 to 60% of the people do die from this. So tell us what's transpiring over those 2 to 3 to 4 weeks where someone is actually able to come out of and then become immune to Ebola.
Yeah, so they have these symptoms that I've just elaborated, and then over a period of time, as their body is able, their immune system is able to recognize the virus, produce antibody, they're able to kill the virus and their body is able to heal. This typically takes several weeks as they recuperate from this infection. But again, they're left with a, you know, a supply of antibodies and the memory cells to make more antibodies. Presumably they're immune at that point. And this is what's given us hope that we may be able to treat these patients effectively. The fact that antibody appears to be effective against this virus. So there's a lot of work being done on developing a vaccine for Ebola. As I understand it, there's a company in Canada that just released 1,000 doses of vaccine to the outbreak areas. Obviously that's not enough, but this is a vaccine that's still in very, very early stages of development. There have been a few doses of another type of preparation, which is preformed antibody. So it's a monoclonal antibody, or what your viewers may know as antisera, directed against Ebola. Unfortunately, there are very, very few doses of that. The 2 missionaries that came back to Atlanta got that antibody preparation before they were sent here. Now, there was a lot of hue and outcry about this. You know, why would you give these doses just to our missionaries and not give it to the poor African nations? And I think these companies were sort of in a catch-22, a no-win situation. These are clearly not tested. And if they had released them, you know, into the population immediately within Africa without, you know, a lot of thought and invitation from those countries, you know, we'd be accused of experimenting on poor, ignorant people that wouldn't know any better. So it was kind of a no-win. Either you give it to the people here where you can watch and learn, or you give it to the people in Africa. I think what has been decided now is that because the mortality is so high and because we really have very little else to offer, that doing some of this compassionate release of these investigational agents regions is appropriate, and if done appropriately, we may be able to learn a lot about it. So I'm glad to see that those things are being done now.
Yeah, the concern was pretty great when we brought the people back to the U.S. I think that probably fed into people being very concerned about this. Anytime you talk 50 to 60%, mortality rate, people get pretty excited about that. And when
Sure.
you bring folks back into the United States, so really, what are we to be concerned about here? Is there to be a concern here in the United States? Kind of put that in perspective for us a little bit.
Sure. So here now today, there is essentially no reason for people to be concerned about actually contracting this themselves here in the United States. So as your map showed at the beginning of the program, there's 3 or 4 countries in Africa where there is some spread. So it's possible that somebody could go to one of those areas, come into contact with a sick person, either through one of these funeral rites or perhaps a family member or some other close contact, and actually bring that back with them. So that is a possibility, and the CDC and other agencies are working very, very carefully to try to prevent that from happening. So travelers are being screened. Sick people are not being allowed to board airplanes. They clearly are getting instructions as they come into these countries saying, if you get sick during the incubation period, you need to be self-monitoring, and if you develop any of these symptoms, you need to come to attention very quickly so that we can get you evaluated and get you segregated from the rest of the population so that you don't spread it. And again, it's not a virus that spreads very easily. Here in the United States, even if we did see some sporadic importation of cases, I'm very, very doubtful that we would see person-to-person spread in any kind of widespread fashion here in this country.
Okay, and you were talking about this coming on rather quickly when we were still in West Africa. How soon after you've been exposed, so those folks that were carrying the individual, so they are finished doing that burial work and then they go about whatever it is that they are doing, when do they know that they're free from concern there? How quickly, when you say that, does it really come on before they can breathe a sigh of relief,
Sure.
thinking, okay, I wasn't exposed?
So the longest incubation period that we know of is about 3 weeks. So if you get out 3 weeks, you're safe at that point. Now, one of the other nice things about this infection, if you can say anything is nice about this infection, is from a public health standpoint that you're really not contagious until you develop the symptoms. Now, sometimes there are diseases where you're contagious for several days before you even know you're sick. In Ebola, you become sick with the fevers and the symptoms right about the same time that you become contagious. So there isn't this period of time where you might be spreading it without even knowing it. They're both pretty much the same. So that does help us when we're trying to figure out how to quarantine folks and how to prevent the spread of this disease.
So you talked a little bit earlier about the future here, but what are we seeing in terms of hope to treat Ebola down the road? And do you believe that, we've gone from Central Africa, you said, to West Africa. Is there any place immune? Do you see it going out further? What is your thought on this big picture?
Well, I think there is room for hope. Clearly, this Canadian company that's released the 1,000 doses of vaccine has some very interesting and very optimistic preliminary data. Now, there hasn't been very much testing in humans, but it certainly looks like it's protective in primates. Likewise, the company in San Diego that had the few doses that they gave to the missionaries, and then they've quickly exhausted the rest of their supply with doses in Africa, is a monoclonal antibody preparation. And that appears to have some promise as well in those studies that have been done to date. But we haven't had well done, well-sized, randomized trials in populations that are sick. And so I think we do have an opportunity to learn some additional things with this outbreak and hopefully help to develop those preparations so that we can either prevent, in the case of a vaccine, or treat, with the case of some of these other drugs that are coming along, Ebola. So I think there is room for optimism in that regard. Now, you also asked, what's the chances that this is going to spread to other places? And I really can't completely answer that, but clearly what we know so far is that the reservoir for this is in certain animal populations that we don't find everywhere in the world. I think this is going to continue to be contained in those areas of the world where you see that reservoir, and then there might continue to be sporadic outbreaks and maybe even a little bit of spread with travelers today. And I think that brings up a very important point about how interconnected our world is. And we can't stick our head in the sand. We can't pretend like, this is not going to ever occur in any place else in the world. It really promotes more of a worldview of infectious diseases and I think societal concerns and politics in general.
Wow, what haven't I asked, Dr. Rupp, about Ebola that is important for people to know, again, to keep this all in perspective? Anything we've missed?
I think that's the key, keeping it in perspective. I think folks see these scary pictures, they see the healthcare providers in the moon suits, and they automatically think, oh my God, this must be the most horrific disease that we could ever imagine. And it really isn't. It's a disease that is spread by close contact. It's a disease that I don't think would spread in the United States even if it were imported here. And essentially today, there is zero risk of this disease here in the United States. So folks who are, going out to the stores to buy masks or preparations of antiseptics thinking that they've got to take action to prevent Ebola are really, really off base right now. That's not going to happen. But I do think that, again, it's a warning bell. It's a signal that we need to, have a worldview of infectious diseases and politics and societal concerns in general. In these countries where there's really no level of public health, there's no health infrastructure, I think we have a responsibility of trying to promote those sorts of developments because that's where we need to fight these infections. We need to fight these outbreaks where they occur and try to prevent their spread to other parts of the world.
Thank you. In the minute or so we have remaining, what can we in Nebraska, other than being aware and being educated, what can we do to reach out to the folks in West Africa? Is there assistance that can be offered there? Have you heard of anything in terms of support?
Well, sure. I think some of these non-governmental organizations, these NGOs like the Red Cross, Doctors Without Borders, they're always looking for charitable giving so that they can continue their mission. Folks who have a concern with that, they can go online, they can make phone calls, and they can figure out how to contribute to those efforts. I think also with this larger worldview, people need to foster that. We need to elect politicians that have those same types of outlooks so that we can help other parts of the world.
Dr. Rupp, thank you so much for being with us today to help keep this in perspective, educate us about what's going on, keep it in perspective so that we can all move forward with some peace of mind, but mindful of those people, around the world who are going through things far worse than we are here.
Sure. Thanks for having me today. This has been a lot of fun.
You bet. Thanks. And thank you all for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours, or email us at considerthis@tvmail.unomaha.edu.